are you willing to take a pay cut? So, of those that are healthcare professionals, they said no. 33% of our respondents were healthcare professionals, and all of them said no. The rest of them were not healthcare professionals. Next question. If you are a healthcare professional, are you willing to be embroiled in more paperwork and justification of services provided, which is one of the features of being a Medicare provider on the professional side? So if you didn't know that, you'd have to be a healthcare professional to know that. That's why the choices were yes, no, and I'm not a healthcare professional. Of those that are healthcare professionals, they said no, they are not willing to do more paperwork and justify services as they do for Medicare. Question 15 was, can you answer the key question? The choices were, do I want it or need it? What key question? Or no? 25% of the people can answer the key question, do I want it or need it? 41, almost 42% of the people don't know what the key question is, so they said, what key question? And the other third said, no, they could not answer it. The next question was, do we need to rework the existing system? 100% of our responses said yes. Every single person thinks we need to rework the existing system. Question 17 says, healthcare in the U.S. is much more expensive than in other countries, the ones without socialized medicine. What do you attribute this to? And 67% of our respondents said greed on the part of the hospitals. 16% said better care, and 16% said better technology. Next question is there a better solution on the horizon? Only 42% of the people said yes. 58% said no. Question 19. Instead of your employer picking your insurance, would you prefer a salary increase and just buy your insurance yourself? 75% of the people said yes, they would like that. The other 25% said no. Question 20 was, do you think your employer profits from your healthcare premiums and deductibles? 75% of our people said no. 25% believe that they do. Question 21. Healthcare was affordable until it was mandated by law. Health insurance was affordable until it was mandated by law. Healthcare was private until it was mandated by law. Would you prefer to make healthcare and insurance free trade again rather than mandated by law? And 75% of our respondents said yes, they would. Is it within our abilities to redact the ineffective laws and rebuild a broken system to one that provides quality care with reasonable standards? And 75% of the people said, yes, we have that ability. Next question. At the current rate of about $15,000 in premiums for a family of four and a deductible of about $8,000, that's $23 a year in care that we could, $23,000 per year in care we could provide for ourselves and buy an umbrella policy. Would we be further ahead if we chose caregivers for our family and pay them a reasonable price for the care? 75% of our respondents said, yes, that would be better. The next question is, would we be further ahead if we insure ourselves for catastrophic diagnoses and pay out of pocket for the small stuff? 67% of people said yes, they thought we would be further ahead if we did that. The next question is Is it within our abilities to care for the indigent, handicapped, and chronically ill? And 58% of our people said, yes, that is within our abilities. I thought that was very heartwarming that quite a few people think we have that ability. The next question, is it within our ability to reduce healthcare fraud, waste, and overuse to reduce the billions that we're currently spending? 92% of the people said yes, that is within our ability. The next question is it within our abilities to choose better health, better nutrition, more exercise, and less harmful discretionary habits that turn out to be detrimental to our health? And 92% of our people said, yes, that's within our abilities. The next question is, would you be willing to exclude those who choose to abuse their health from insurance and or free care? 73% of people said yes. Wow, that's a lot. Question 29 was, do you believe the government has your best interests at heart? I'm sorry to report to everyone who is part of the government that 100% of our surveyed people said no, they do not believe that. The next question was, do you believe the government can fix this system and improve it? And 75% of our respondents said no. The next question is, many healthcare executives and managers claim they can't make a profit on the Medicare allowable, which does include a profit margin even for nonprofit companies. Yet they get paid millions per year in salary and benefits. Do you believe there is a crisis in healthcare management? And 82% of the people said yes, they believe that there is. Do you believe that those who are employed in the healthcare system and get paid over $1 million a year are opposed to healthcare reform because they don't want to take a pay cut? 91% of our people said yes. And keep in mind, some of our people work in that system, remember? Woohoo! We're getting close. I know I sound like I'm going on forever, huh? The next question was, are you willing to contact your elected representative to provide input on this matter? 64% said yes, they are. The next question was, because I kind of was curious, are you currently receiving Medicare benefits? In other words, do you know what you're talking about if you are looking at this for everybody? 25% of our surveyed were or are currently receiving Medicare. The last question was, are you currently receiving Medicaid benefits? And only 8% of the people who took the survey are currently receiving Medicaid benefits. So we got some really interesting answers, and a lot of people are in agreement on a lot of topics. Now, if you want to join the discussion of Medicare for All, please do be in that group that contacts your elected representative and let them know how to best represent you in the coming negotiations, because this is an important topic for everybody. So do it as soon as possible. The results here indicate that there are a lot of people not in favor of the solution currently being proposed. So you might want to speak up before it's too late. Now, usually I help you solve your money problems, but I'm not going to solve this one for you, but I'm suggesting that you very seriously think about what you do and stand up for what you really want before we end up with Medicare for All. Maybe we need to design something a little bit better. It might not be the panacea that they're telling us that it's going to be. And as always, if you need help with your current finances or surprise medical bills, please reach out to me. I'll be glad to help you or find someone who can help you. We have a good network of people going on these days that are very interested in helping you be a better healthcare consumer. We've had some on our show, and I have a few that are linked to me on LinkedIn. So if you reach out to me and you need something that I am just not able to provide, I'll try to find someone for you that will provide it for you so that you can get out from under the sometimes disabling debt that comes with unexpected medical expenses. And remember, you can reach me at rcmoneycoach@gmail.com, or you can go to the website rcmoneycoach.com, www.rcmoneycoach.com. So, and it's so nice that you are all here and that you all took the time to answer the survey, because it really gave us a good feeling for all those questions that we asked and what people are really thinking. And now you can take what you're really thinking and formulate an email, a letter, or a phone call to your elected representative, letting them know that you would simply like a little bit more inclusion in the plan and you would like it to be a better plan. And you know what I'm going to say before I say it, but I'm going to do it anyway. Be grateful, and you will attract good things. Until next time, this is Rhonda Cobb, the Money Coach, and you know you can count on me because I get results.